So thank you so much for taking the time out. I hope I'm not taking you uh, for too much time away from your patients.
That's okay.
Okay.
So,
So
how are you?
I'm good. I'm good. Thank you.
Mm.
So we'll quickly start the interview. Let's start. Uh, Welcome, Dr. Manish Chandra, to the Power of People magazine interview, and we welcome you on behalf of the entire team. Let me tell you a little bit about us. We are an organization that interview people who have been motivating and inspirational to the rest of the society and have done much good for the society. So it is our privilege that we are able to speak to you, and thank you for coming on to be a part of this interview. About Dr. Manish Chandra, he is an eminent radio-oncologist from Mumbai. He is very well known in the country and has treated multiple patients of cancer. And may I ask you, Dr. Manish, to tell me a little bit about yourself?
I did my post-graduation from Jaslok Hospital. And after that, in my initial part of my life, I moved to Loni, a rural medical college, served there for a year. And from there, moved to Nasik. It was a charitable hospital, which I started. And I managed this hospital for nearly the next 7 years. And after that, I moved to Thane, in Jupiter Hospital in Thane. So it's roughly now 15 years. And at Thane, we have treated, or in last 15 years, roughly on an average around 1100 patients per year. So we can consider roughly around 21,000 patients that we have treated in last 15 years at Jupiter.
That
My
is a
special
huge
interest is in
number.
my special interest is in gynecology and breast cancer. We do some head and neck cancers also, but mainly gynec and breast cancers.
Uh, so my next question to you will be, what inspired you to take medicine in the first place and then get into oncology as a specialization?
For as far as medicine is concerned, to tell you very honestly, Richa, even I don't know why I became doctor. Very honestly, I was always interested in engineering field, and somehow there was some thing which happened after 12th that I thought, okay, let me become a doctor. So that's why I switched gear from engineering to medicine and appeared for the, at that time it was I did it from UP. So at that time there was a combined pre-medical test of UP, got into Government Medical College, and that was the main inspiration. And then when we were doing for our post-graduation, pathology was very interesting, but pathology being a non, yeah.
Yeah, that's a very heartening result that you have been able to achieve with your treatment. How do you deal with the situations where you can't do anything more, or there's a as you can say, the people who have not responded to treatment? How do you deal with that?
We do face these problems very often because if we see the overall cure rate in even in the best of the center never exceeds 40-45%. So we have to deal with roughly around more than 60% plus patients where we are not in a position to cure them. We are not in to we provide the palliative care to them or whatever best we can do it. Again, it depends a lot on the patients also. There are some patients who are very understanding, or I would say their thoughts are extremely clear. They just really say, okay, they know, so whatever best we can do for them, they will try. There are some patients who don't accept it. So the acceptance becomes a big challenge for many patients. But most of the patient who accepts it, they go through the entire process, even though it is not good. They tolerate the entire process quite well. as far as it is for us, it is definitely very, very draining, emotionally draining. One of my colleague here, he always say this is something called compassion fatigue. That entire compassion from your side is gone. So you are completely fatigued because of that. So yeah, sometimes we do feel these kind of things, and you being a doctor, you also know that those things sometimes comes in batches. Then the whole week you are seeing all the patients who have not done well, and the next week you are very elated because most of your patients who have done well are coming. So these kind of waxing and waning is there. We really cannot change it much, but it is a part of our oncology practice. We do see losing our patients and other things at some time, but this is something that we are trained, a long years of training have trained us to accept it.